All this week, we've been highlighting what's changed since the COVID-19 pandemic drove billions indoors around the world and killed more than 1 million here in the United States. So for some perspective, 5 years later, we turn to CBS's chief medical correspondent, Dr. Jon LaPook, for tonight's interview. Hello, doctor. It's good to see you again. All right, 5 years later, what are some of the big lessons learned?
How much time you got?
Yes, exactly. We'll go to breakfast.
First of all, it was a stress test on our public health system, which we did not do very well on. We've been chronically underinvesting in it for years, and it showed up. For example, there's no good communication from all the different 50 states. It's like there were 50 different countries to the CDC. The CDC doesn't have the ability, the power to demand that they funnel information back to them. And I was out in California doing a story about public health, and I saw the fax machine that was being used by local doctors to request a COVID test from the public health system in Oklahoma. There's been electronic secure transmission of information for decades. So way behind. That was one of the first things that happened.
Now we're in the middle. Do you see either any improvements, or do you see kind of the same problems with the measles outbreak and also the avian flu?
I see a lot of the same problems. Of course, the science did great. We had these amazing vaccines. We had Project, Operation Warp Speed. We had messenger RNA. We had understanding that it's in the air, the aerosolization. So a lot of things were learned. But the big problem was communication, right, and public trust. And I think there was a lot of mixed messaging where people were hearing one thing from one person, one thing from another person, and not always a scientist or person who was trained in public health communication in terms of communicating information. And that's a problem. I am so careful about every word. You can't unsay something to 5 or 10 million people.
Right.
And I think there was a lot of stuff said. And there was also, I think we learned some humility. We were criticized for saying, look, this is the way it is, and not really emphasizing, but it could change.
Right.
And I know that we said that all the time, but people forgot that. And they also forgot, I think there's some amnesia, how bad it was at the beginning. I was on the COVID wards in April of 2020 at NYU Langone Health from a professor. People were dying left and right. We were worried about, remember, bending the curve because there wasn't enough resources. So when people talked about, staying home and all the measures that we took, they kind of forget, that was happening, but it was coming out of that in a smooth way, the smooth transformation that was tough.
What I want in the last 30 seconds, Jon, is mRNA was a major factor. What's on the edge that's coming that excites you that might help with the next pandemic?
Well, I think messenger RNA, again, is an amazing thing in terms of vaccines, but of course it's coming under challenge right now given the new administration. And I know a lot of my colleagues are very concerned about whether there's going to be the kind of support for basic science that we need. And remember, President Trump was saved by monoclonal antibodies. The research for that happened over 30 years before that. So it's not like you can get sick and say, okay, let's do the research. You have to rely on the research done decades ago in order to have the drugs ready when you need them.
Dr. Jon LaPook. Thank you, Jon.